This very forum, a couple of years ago, you may recall that Professor Walter Lutz, featured there up in the corner, presented a conceptual model of healthy aging. And this is where he synthesized the literature and did an excellent job portraying what goes into healthy aging. And so when we talk about healthy aging, these are the things we mean. And just like Senator Jalen mentioned, it's a broad, comprehensive view. So we think older adults will have good diets, be socially engaged, be physically active, lead meaningful lives, be proactive about their health, and feel safe and secure, and live in communities that support these goals. Why does that matter? Because our population is rapidly aging. We are living in remarkable times. It may not be as dramatic as the discovery of fire or learning to walk upright, but it almost is. In just a century, we have seen tremendous gains in human longevity, right? If you were born in 1900, you could expect to live to about age 47. And if you were born in 2010, you could expect to live to about 80. So in a little more than a century, we've gained more than 30 years. It's a tremendous gift. What does that translate into terms of numbers? Well, we're talking about more than 41 million Americans today are age 65 or older. And depending on what statistic you look at, 8 to 10,000 adults are turning 65 every day. So it's a remarkable transformation that we're witnessing. It also means job security for those of us in the aging business. What's happening in terms of Massachusetts? Here's an excellent chart prepared by the UMass Donahue Institute, and it shows you the population distribution now and in the future. And so we're most interested in this top category, the light blue shade, which represents the percent of the population that's age 65 or older. And so in 2010, you can see that it was about 13.8%. And then we see a slow, steady increase over time until in 2030, it's more than 20%, 21%. So greater than 1 in 5 will be age 65 or older in Massachusetts. That has tremendous implications for our life. So I don't know if there are any movie buffs in the audience, but here's the very scientific slide portraying The Lion King. And if you remember, the emotional peak of that movie was when the wise old baboon lifts up the young lion cub to show that the long-awaited heir has arrived, that things will continue. The person we've been waiting for, or the animal we've been waiting for, is born. And so in the same way, I feel like that wise old baboon holding up tools for you to put into your healthy aging toolbox. I'm going to present. And now this is where the AV person is going to earn his keep. We're releasing 66 maps portraying indicators at the individual community level so that you can see what's happening in terms of healthy aging, what problem areas exist, what needs attention. Not just that. The community profile, turn it up a little. The community profiles themselves, this is what we're thrilled about. Each city and town has a level of detail that's never been reported before. So we have population characteristics, physical and mental health, preventive health behaviors and wellness, and chronic disease indicators, community values and state values. So you know what's happening in your community. And for the data nerds, we have the health indicators along with the confidence intervals for the estimates that we report. On the website, we have interactive maps portraying the chronic disease indicators that will allow you to zoom in on regions or communities and to see what's happening. We believe in transparency and reporting. We want you to know what we did, why we made those decisions. So I recommend and encourage you to access the technical report. And if you don't have time to sit down and digest the 3,000 pages that we've created, we've summarized it for you in the highlights document. We report the indicators by region, a summary of our key findings, and we go indicator by indicator so that you can know what the status of healthy aging is in Massachusetts. What do you think? Now, none of that would be possible without a spectacular research team. And here's a slide showing our beautiful seaside campus at the University of Massachusetts, Boston. And I'm going to ask the research team to stand up. Frank Perel and Nina Silverstein were co-principal investigators. We're assisted by Che Lee and Sebastian Che, and two of our other research assistants are not back on campus yet. So I thank you for your efforts. I'm so proud to be a part of the team. We're also grateful for the financial support provided by the Tufts Health Plan Foundation. This project never would have happened. We would not have this data or these products without their support, their leadership and guidance, so we are grateful for it. And if Ellen Bruce is here, anywhere? Stand up. I want to recognize Ellen Bruce, who's director of the Gerontology Institute, who also provided financial support for the project. Okay, so let's dig in. Where are these older adults in Massachusetts? And here's a graph that shows the density of population. And so if you're not familiar with reading graphs, you can look, oops, I'll try not to do that. If you look in the bottom left corner, you can see the box and it says 1 dot equals 100 people age 65 or older. And then you can see the cluster of dots. And so what strikes you? Well, you can see that Boston has a lot of older adults. Worcester, Springfield, Pittsfield, Fall River and New Bedford, and some sprinkling along the Cape. That's one way to look at the story. And then if you want to look and see what's the percentage of people in communities that are age 65 or older, this is a little bit different picture, right? So look back, and here, wouldn't you think Boston is a ton of older adults, lots of green dots. But if you look here, it's a fairly young community, right? It's a lighter shade. And where do you see the dark colors indicating higher rates?
Cape.
Cape? Berkshires. Retirement destinations, right? So, first the good news, then the bad news. Okay, the good news, in terms of national averages, Massachusetts is better for arthritis and COPD, chronic obstructive pulmonary disease. So that's something to be proud of. And when compared to other states that rank states on healthy aging indicators, Massachusetts ranks near the top. And in fact, we were ranked first for older adults obtaining health screenings among persons 65 and older. That's all good news. If that weren't enough, but there's some bad news. When you look at diabetes, we see 1 in 3, 32% of adults age 65 or older have ever been diagnosed with diabetes. It's a stunning rate. Depression, hypertension, and Alzheimer's rates are all higher than national averages. And think about this one. Almost 60% of people 65 and older are living with 4 or more chronic conditions. We've got a lot of work. There's more bad news, sorry. When you look at obesity, 1 out of 4, nearly 1 out of 4, 23% are obese, and that's a BMI of 30 or greater. 15% of men have prostate cancer. Only 2 out of 3 adults 65 years old and older get flu shots, and a striking only 15% have taken a shingles vaccine. So there's a lot we can do. Let's take a look at a couple of the indicators. Here, this map shows the distribution of Alzheimer's disease and related dementias. And if you can zero in on the darker communities, and maybe your geography of Massachusetts isn't as handy as you'd like, when you go to the website, you'll be able to have the names of the towns light up. But here I've highlighted you can look and see that the state average is 14.4, that rate. And yet there are a number of communities that it's in the 20%. Gardner, Roslindale, Webster, Jamaica Plain, Chelsea, all significantly above the state average. How about hypertension? What's the picture there? Here you can see some problems with hypertension. The state average is 77.5%, and communities that are struggling with challenges, Somerset, Fall River, Taunton, Roxbury, New Bedford, all of those are well above. And diabetes. So state average of 32% was high enough, and yet here we've got communities well above that. The Boston neighborhoods of Mattapan and Roxbury, 49 and 47% respectively. Fall River, Lowell and Lawrence. So some takeaway findings, things to note. And these are priority communities. These are communities that I think we should put at the top of our list in terms of attention and creative interventions and support. New Bedford, Springfield, Fall River, Worcester, Lowell, and South Boston. The numbers in the column to the right represent the number of indicators out of 100, it's in the 90s, but almost 100 indicators that we report, that they're statistically significantly different than the state average. So New Bedford is struggling with 31 indicators below or different than state average. That's a community that we could focus on. And you may remember that wonderful speaker we had last year who talked about the blue zones. Anybody remember him? Plus he was gorgeous, right? So people want to know, where's the blue zones in Massachusetts? And we don't quite have the answer to that yet, but here are some communities with strengths that we observe. And so we're not ready to put up a map of Massachusetts with blue zones highlighted, but here you can see Carlisle, Wellesley, Harvard, Brookline, Belmont, and Stowe all are doing significantly better than the state average. How about the community profiles? How do you read those and make sense of them? And here, I want to just walk you through one example. And in deference to State Senator Jalen, I've picked Somerville so that you can have the data in hand. And I believe the password requirement has been lifted from the website. So if you have a tablet with you or your laptop, you can all access it right now and ignore the rest of my talk. But here you can see in the report, the first part, we summarize in narrative format what we see in the data. And then the bottom part of the narrative describes the resources that that community has that may promote healthy aging. There's a beautiful map that shows you where in the state that that community is located. And we're so grateful to Elizabeth Costello and the John Snow team for helping us to make our community profiles look as nice as they do, because believe me, it would all be a data chart if it were up to us. So here, when you look at the population composition, you can see the community figures and then compare it to the state averages. And when we look at Somerville, you can see the number of people that we're talking about who live there, the population, the percentage of the population that's 65 and older, and then the breakdown, whether it's young, old, or very old. And so when you look at Somerville, you can see that only 9% of the population is 65 or older, compared to the state average of 13. And maybe the font is a little tough for the people in the back, I apologize, but just go and download all the materials as soon as you can, and you'll be able to see what I'm talking about. If we go to the second page of this, you can see the physical and mental health indicators and the chronic disease. One thing I want to point out to you here is that we've indicated in this column saying better or worse than the state rate, where the rates that we report, let me just give you a little statistics refresher in case it's been a while for you. When we calculate rates, it's an estimate, statistical estimate, and there's a margin of error that surrounds that estimate or confidence interval. So we have the community rate and then the state rate. And when we're confident that the margin of errors do not overlap, that there's a true difference, we've indicated that so that you know that that's an indicator that's significantly different than the state rate. by extension, would be a problem or a success to focus on. And then we've got access to care, service utilization, wellness and prevention variables, as well as community variables, the walkability of a community. And so Somerville is a walker's paradise. And we get to safety. So in terms of violent crime, Somerville is lower than the state average, but property crime, it's higher than the state average. And the Elder Economic Security Index is a cost of living index, what it costs for an older person to live in that community. And so you can see that Somerville is a little bit above the state average in terms of cost. So here are some, I just want to give you a quick look at some interactive maps that were created by that photo is my cousin, and I had threatened to use a baby photo of her, but I didn't, I used a real one. So she creates maps and charts for the New York Times, and she donated these maps to the project to help us, and so I'm grateful. And I just want to give you a quick tip on how to use these and think about this. As you go to the website, you of course can look and see where you live, or you can click along the left and see the chronic diseases, scroll across the top and you can see the rates. You could zoom in on a region of interest, and it's just a very dynamic way to let the data speak to you. So I encourage you to do that. I think that'll suffice for that. Yeah, it's exciting. So the data sources, I'll just touch on briefly. These are fully described in our technical report, and I encourage you to read it. But we calculated rates using data from the Centers for Medicare and Medicaid Services, the census, and the Behavioral Risk Factor Surveillance System, as well as many other sources of data too. And again, let me encourage you to check the technical report so that you can see how we calculated the rates, how the geographic areas were defined, and our procedures. If that weren't enough, I'm exhausted just from telling you about that, but there's more. We have a dynamic list of 150 evidence-based and other programs that exist across the state. And so we encourage you to go to the website and check and see what programs are there. Take advantage of them. If your program's not listed, post it. We have a format where you can do that. Make this a dynamic list so that we have a living inventory of what's happening across the state in terms of healthy aging. So what do I want you to do? I want you to understand, act, and engage. Understand the data. Spend some time with it. Look and see what's happening in your community and across the state. Act. Spread the word. It's not enough just to hear. We want you to act, tell others, get others in your community or in your agency excited about this data and aware that they exist. Engage with us. Join the Healthy Aging Collaborative. We need your energy, we need your ideas, we need your participation. We want this to be a grassroots demand that healthy aging become a state priority. Support policymakers who get it. We need their voice. We need them to have a megaphone as they advocate for needed resources to improve healthy aging. Not only is it the right thing to do, it'll save us money in the long run. Together, we can make healthy aging a priority in Massachusetts and in turn be a model for the nation. Please join us.
I'm very excited to speak about how we at the state level can think about using this data and how each and every one of you can encourage others to use it in your communities as well. But I'm thinking that as I look around the crowd and I see who's here, and I know that we've gone from 200 at the beginning of this endeavor of healthy aging to 440, I think about how we're actually preaching to the choir here. And what I think we all need to do is make sure that we preach to more people than just the choir who's here. Every person who's spoken already this morning, including the senators and representatives and everyone else, are all part of that choir. We've all been working together over the last 5 years and more to make sure that healthy aging is on the agenda. So we've encouraged many of you to join us. You've been here without restraint. And we encourage you to then talk to many more people about this as well. So my call to action for you is to talk beyond yourselves, make sure that people really understand what's happening across the Commonwealth, make sure that people understand that aging is a lifelong process and that hopefully we all will reach old age if we can. How many people here who had grandparents who reached the age of 70? How about parents? How many of you expect to reach the age of 70? Or have already done it? Okay. Wait, how many people think you're going to reach the age of 70? Where's the rest of you? I'm surprised by that. Again, I think in Massachusetts we know that our lifespan average is longer than it's the 6th longest in the United States. We're the 6th ranked for longevity. It's about 80.2 years is the average lifespan, and we know that if we adopt some of these healthy aging activities, we will actually live a lot longer than that. It used to be that people used to recognize people when they reached 100, right? Now there's too many people to be recognized in that range. So again, I want to thank everyone here who has been active in this campaign and in this project, and really look forward to working with you on an ongoing basis. Clearly, again, the other statistic that I like to make sure people understand is that of all the people that have ever been born on this earth, 2/3 of everyone who's ever reached the age of 65 is alive today. Wow. That demonstrates how the demographic is changing and how we all need to be aware that society as a whole needs to address the issues of aging. And it's something that, again, preaching to the choir once again, we all know how important this is, but those of us who are outside of this room often don't understand that. And it's our job to make sure they do. This tool, the community profile tool, is a great tool to do that. When I looked at this data and I thought, this is so hard to put together. The reason it hasn't been done to date is because it's a really hard job. So I really want to congratulate Beth and her team for having done it. It's an unbelievable compilation of data. What we do with the data is really the next steps. When I look at this, I see communities that clearly need additional supports for improving the health of their communities. I see communities that are doing pretty well now, but probably have just gotten lucky because their residents have more education and more supports through their lives. The aging agenda, which I believe was passed out that we developed early on in my tenure with the governor, demonstrates that aging is a life course process. And if you support people younger, if you give people better education when they're younger, they will age better. If they have health insurance or health coverage when they're younger, they will age better. Those are the kinds of things that we need to be clear on, that you don't just start improving aging by working with people over age 65. You really need to focus on making sure that lifelong supports are available for people over time. And I think this data will demonstrate that if we look deeper, and when we look deeper into it, it will demonstrate that. So I think it's important to make sure that we continue to encourage communities to pay attention to what's happening with their youth, with their younger people, with their educational system, with their healthcare system. And again, that's one of the reasons why the governor has made those two priorities, his priorities, over all of his tenure and as well as in this last year of the administration. That being said, we do have to pay attention to the people over 65. We have to make sure that people over 65 have access to the kind of supports that can help them maintain their lifestyle in the what do they call it? In the way to which it's, I can't remember.
Custom.
Huh? Oh, the way to which they're accustomed, exactly. So we need to make sure that we have those available. Some of the things that we've been doing at the Executive Office of Elder Affairs and with the Department of Public Health, as well as many of you in this room, have been really looking at the chronic disease self-management education process and making that available across the communities. I believe there was a poster session that you saw if you went to the poster sessions this morning, and it's one of those things that I think we can look at very carefully, and hopefully with this data as a benchmark, and as we look at this data over time, we may be able to see the impact that some of those programs have. We may be able to look and see the impact that some of those programs have had to date, because if we look at where some of those programs are operating in full force, we may be able to actually see that there were improvements there. So my comments today are really in keeping with what everyone else has said. First of all, we have to make sure that we don't just preach to the choir, that we get out, we talk about these things, we encourage community leaders within each community to look at their data. It's your responsibility, not only as professionals, but personally, to go to your community leaders and make sure they know this data exists and that they understand what it means for them. With an aging population in every community, things need to be done differently in many situations in the community. So make sure that you talk to not only your friends and relatives, but also your leaders in your community. So I actually think the profile will raise more questions than it answers, and I think that's important, and that's important, why it's important for everyone to talk with Beth and her team over time. Let her know what it is you want to know that you don't know. Figure out what kinds of questions you need answered in order to make a difference in your community. So I encourage you to, again, engage with them around this data and make sure that you use it well. And finally, I want to commit as a government leader to make sure that we are doing all we can at Elder Affairs, and we will work with the Department of Public Health and each and every one of you in this room to make sure that we are addressing these needs across the Commonwealth and that we are doing all we can to help people understand what the aging process is all about, what it is not about, and those are the kinds of things that we will continue to do over time. So again, thank you very much for inviting me, and I look forward to the conversation.
Thank you, Secretary, and I will just say a quick thank you to everybody, since everyone's been thanked by everyone, for putting this together. This is really a terrific forum. I've been to all of the forums now, and I think this has really brought all of the information together into these community profiles that for the department is really critical to our work. We do our work based on evidence, and having these community profiles are really critical for the work that we do with community-based organizations. And I think a couple things struck me by the data and things that are happening at the department. When I first came to the department 6 years ago, I was the division director for what was then called Health Promotion and Chronic Disease Prevention, and it was 8 chronic disease programs that were siloed and not really working collectively. And I think that we can see, based on the data, that there are common risk factors and that our seniors have more than one chronic disease. So working in silos really doesn't help the person holistically. And as a nurse, when you take care of a patient, you take care of them with all of the conditions that they have. And so 59% of older aging adults have more than 4 chronic disease, 59%. That's a lot of people that need chronic, an integrated approach to their chronic diseases. And so in the department we spent several years really looking at how to do this integration, and we have, I'm proud to say, come together from 8 chronic disease programs into functional areas of work where we really do our work with the community. So we have the Office of Community Health, where we work in the community trying to adjust policy systems in the built environment so that we can make the healthy choice the easy choice in the community. And knowing what communities to target will certainly help us allocate our resources better where there is a larger burden of disease, rather than looking at a statewide approach and individually addressing communities. We'll be able to go where the burden is the most. And then we have the Office of Clinical Preventive Services, where we can really try to look at care coordination and patient-centered medical homes. Again, we can look at screening rates of these different chronic diseases and target communities where we need to bring more resources. So this is really exciting data for us. And some of our other goals that this really provides a framework for us to support is health equity, despite the fact that, again, we try to look at healthy aging across the lifespan in all of our programs. We also realize this is a unique population that has special needs, and so so that it has disparities that need to be addressed. So again, seeing where the priorities are important. And I think it was alarming to see that 32% of adults over 65 have diabetes. If we compare it to our statewide general population, it's 8%. So we can see where we have to do some more work in this particular population. I think also looking at how we're preventing chronic disease now is through our Mass in Motion and community transformation grants. We're in 52 municipalities where we're addressing healthy eating and active living, where obesity is this parallel epidemic and trend that as we increase overweight and obesity, we're seeing a rise in chronic diseases. And we used to have an individual approach where we brought clinical interventions and counseling one by one to a person, trying to get them to change their lifestyle and behavior. And when you have 2/3 of a population overweight or obese, we really can't afford to go one by one. So we really need to make these policy and system-wide changes that, again, make the healthy choice the easy choice. And so within our Mass in Motion, I'm happy to say that we now are focusing, we're giving out 5 grants to have healthy aging champions in 5 of our Mass in Motion communities, so that we can really make sure that our policy systems and built environment addresses some of the unique needs of seniors. And particularly if we think about social isolation, if we're building sidewalks and opportunities for physical activity, if a person is socially isolated, they may not know about it, they may not have a way to get to the places that we're trying to make healthy for them. And so, again, this data can help us to drive where we're going to do our work. And then last, I'm really excited about, on Monday, we'll be announcing the awardees for the Prevention and Wellness Trust Fund. There were 20 applicants, I can tell you that, and I think we have come down to selecting 9 awards, and it's really focused on trying to prevent chronic diseases and save costs. This came out of Chapter 224 and supports healthcare reform, one of our major priorities at the department, and we want to really reduce preventable chronic diseases, and we're focused in that area that 4 conditions falls in the elderly, hypertension, use of tobacco, and pediatric asthma. So the Prevention and Wellness Trust Fund, I think, will give us models of linking community and clinical care together to reduce preventable chronic diseases. So this report will really help our work a lot, and thank you all to those of you who worked on it and put together such a comprehensive look at our senior population.